All, this is Dr. Mobeen Sayed from Drbeen.com. This is a third show for today. Thank you very much. And this is our random chit chat. This is our discussions. This is our COVID points. So welcome everyone. Jim is first today from Iowa. Welcome Carolyn. Welcome DDS. Welcome France. How did this happen? My third lol. Yes, you are. Welcome France. What should I say? Bonsoir. Bonsoir. Doug, fourth, welcome. DDS, three-way tie, possible. Michelle, hi Beans, welcome. Lorene, hello. Christy, hi from Florida, hi back to you. And then there is a long list now. Margaret, welcome. Barbecue, Bean, finally I'm timely to a chat. So my tech team today gave me a tour of the Bean registry. It is not fully working as I expected, so I have given them some feedback. So possibly in another day or so, we'll have the registry going. And then there are a number of folks over here. So welcome to everyone. As Barbara said, Cat, Bean, and Lotus are back. France, Lorraine, hi there. Super Cat, absolutely. So tell me this: did you had a chance to listen to? Did you have a chance to listen to Dr. Lori's talk? What did you think of that? And Jana says, thank you all. Said, I am Din Plebeen. Very good. Jana, so you were out for IVIG yesterday. Hopefully you're doing well. Did you feel any improvement? There is a redox bean. I love this redox bean. And I also loved Himalayan bean. So Carolyn says it was great. Thank you very much. So what was the takeaway? I think I can actually relate to this. The talk was both great and frustrating. Let me guess. The talk was great because there was a lot of good information there and lots of confidence that can be built with ivermectin. Seeing that, frustrating that WHO comes out and says, sorry, we are not convinced, and actually picks and chooses wrong or those studies that can actually show the results bad. And more frustrating, you might have seen that at one point I went back like this. I was so frustrated, where the data on the left was showing that there is a statistically significant positive result, and the narration on the right showed how they narrated it to say it is dangerous. And they knew that people will not be able to correlate all of them, and they didn't care for those who could. And that, I thought, was blatant fraud, in my opinion. Texas Bank says, pork and bean, pod and present. Hello and welcome. Fantastic interview. I was thinking to, there are some pieces in there where I think the internet function was not doing very good and we got frozen. And so I was thinking of going in and editing those pieces out. But I thought generally it was a great chat. I am going to do two follow-ups with Dr. Lori. One, to answer the questions that were remaining, and second, to actually only talk about for 5-10 minutes about WHO. So she said, I'm collecting more data to understand what they said, and I want to then present in context of the overall data. So I thought that is a very good thing as well. I'm also going to request Dr. Corey to come back as well and have a discussion, especially in context of WHO. The worry that I have, the reason I want these folks to come in and talk, is that now there will be a momentum, just like this Surgisophere study that came out and WHO stopped hydroxy. And then in many countries where hydroxy was being used was stopped because WHO said it is bad. And similarly, I think now that WHO has once again said it's not good, it's going to hurt people around the world. And so that, I think, is my panic at this time, to see, can I bring in more people and talk more about it and keep the momentum going? You're very welcome. So Liza says Dr. Laurie has all those clinical trials available. I feel that these trials are available, and many of these are actually listed on FLCCC site. Bob Bessel says my 36-year-old daughter had J&J vaccination Monday. She got terribly sick. Sorry about that, Bob. How is she doing now? So this is Monday. So today is Thursday. Has she started to recover? Francis, a fantastic interview. Maxi, should I respond, France, by saying Khemia or Maxi? Doug says, hello, late beans. Hello to everyone. The house says it is so sad that we cannot trust a government to play straight with us. The problem is that WHO is not really part of our government, right? They are a neutral, supposed to be a neutral authority funded by all governments. But even our government's wings, and again, this is not political Trump or Biden or anyone. I'm talking about bureaucracy. I'm talking about the wings, the medical wings. They're not doing good. They haven't helped at all. And this morning, I had some offline chats with Dr. Laurie. So, of course, these were offline. I don't want to reveal it, but I can just tell you how frustrated the whole community is that these folks in leadership roles continue to mess things up for their interest. For them, they have hit a gold mine in the form of pandemic, that they can earn money, tons of money, and they don't care if there are other solutions available. They don't care for the people. Okay, so let's see if there are any questions as well. Colin says it was educational in two ways. Number one, we got the metadata angle, and two, we got to see how hard you guys get it with the corrupt WHO. Respect to all of you. And that is what is interesting. I was seeing that some of my friends, some of my colleagues, they are actually afraid of sharing our videos or these messages. They're afraid of two reasons. One, they are in this machine, which I am not in it, but they're in that machine, and then kind of siding with these folks who are talking against WHO may in the future be pulled from their social media record, and they may not get something that they may get in the future. Second part is that they may actually have an issue with their licensing. People might come in and challenge them and so on. So in this kind of a situation, for a number of doctors to actually put their careers on the line and then try to say, we are saying this, it is a very difficult thing. And I think, I was thinking about it, that if a single person is afraid of sharing it, then imagine a doctor who is talking about it openly and owning it and saying it to millions of people. How much of a risk have they taken? So respect for Dr. Paul Marek, Dr. Corey, Pierre Corey, Dr. Laurie, Dr. Eli Schwartz, Dr. Carvalho, and all others who are talking about these solutions. Kevin says, Dr. Bean, shouldn't you plan to create a panel of entire FLCC team and other doctors to now appeal to the public to recognize that we as a grassroots movement can come together to control pandemic? I think so. Here's the deal. I have thought about it the whole day today. The reason is there is another news that I did not share. Dr. Laurie's team has reached out to ask me if I would like to become chairman of a part of their conference and discussions. So they said, could you chair that? Could you be the chairman? And I was thinking that at least in the societies where there is a lot of rules and regulations and red tapes, which are good thing, but at the same time, at this time, they are bad thing as well for these kind of situations. How do we disrupt this other than creating this momentum? But let's say more people know it, Kevin, as you're saying. We go out to people and we say, hey, this is what is happening. Dr. Corey went up to the Senate. And what happened was there was momentum all the way up to WHO. And then what happened? WHO came back and they said, sorry, we don't like what we're seeing. We are against it. So, what is the way to get out of that situation? The wall at the end. That is where I actually thought about the whole day today. That yes, so Dr. Corey asked me to moderate one more panel for them. Dr. Lori's team asked me to to be a chairman of a conference they want to do. Um, I'm going to invite those folks once again as well. But think about it. We are still fortunate in the US that there are still doctors who are prescribing ivermectin. In many countries, they're not. For example, look at Philippines now, what is happening there. UK people are not prescribing it. I do not know what is going to happen in the US as well. How do we get out of this issue? So Rajesh says Dr. Lori's proposal for Dr. Mabeen as chairman is a well thought out offer. That's very kind of them. And I actually have not yet responded. I hope they do not hear it. So soon after this, I will respond. Gold Country Russ says, question, Connie Carlson, my mom is on ventilator with COVID pneumonia. I am so sorry, Gold. High inflammation, WPC elevated. Can be given with an active infection? Does it completely suppress the immune system? No, it does not suppress the immune system. It is going to suppress the cytokine storm part. It's going to control it. It does not suppress it. So yes, it should be given. And I'm so sorry to hear this. I hope that she's okay and she survives this and she comes back and recovers fully. So Janet Taylor says, let's do it, make a change. How do we make a change without being anarchist, without causing rules to be broken? How do we figure out ways to save? So now I think it is clear, this 1 year long march, which we did all of us together, shows that there are solutions. In this way, we have collected those from the research workers. We are grateful to them. But we have now collected a tiny purse of those little gems. How do we make sure that we can now use it? It is such a frustrating situation. Mr. J says, have we learned the full extent of how the virus affects the CNS? No, we continue to learn more. We know some. Yes. Francis, we can do one session to noodle this. Yes. Or maybe a Zoom session. Diversity Love says, Dr. Bean, the medical liability risk will slow the truth. Only an advanced public theory panel as information would work. Disclaimer to announce theory only, not advice. Yes. Yes. So something like that would be done. T. Martinez says, Dr. Mabeen, greeting from Florida. How do I find out if I have the antibodies? So for the antibodies, you can actually do online test as well, where you can say, here, I think Quest allows it. So you can say, I want to check for antibodies, and then you can get the test done. Which tells me, where is Rima? She's going to ask me that, hey, did you do the test or not? I didn't do that today either. Rima, I actually forget. And then when you remind me during this, I forget. And then later on, I don't do it. My apologies. I should do this. Ivermectin bumper stickers, yes. Oh, that reminds me. I wanted to show you the Ivermectin Man that I redrew. It is the same man, but I drew it with high definition for the shirt. So can I show you? And if it seems reasonable, then we can, I can make the shirts with this. So give me 1 second. I'm going to, okay, so I'm going to share my screen, and I actually, maybe I should have, ask some professional to draw it. But let me show you what I did. This is what I did by myself, all by myself. So 1 second. So 1 second. It is This is one view of it, because it is on a transparent background, so it is showing up as gray, but whatever is the t-shirt's color, it would just take that color. And on a white background, it looks something like, let me stop sharing for us. It would look something like this. So what I did was I actually made it in Illustrator. Um, are you okay with this? If you are, I can then put the T's together. Machiavelli always says, "Where is the nose?" Ivermectin Man doesn't have a nose. Should we have? Doug says he has no nose. Doug, if you did not notice, he has never had a nose. So should we have a nose? Machiavelli says needs a bump for the nose. I can create a bump, but I actually thought that you may have noticed all of my cartoons do not have nose. So that is just my style. So I can give him a nose if that would be important. Margaret says, "Where is the superhero Ivermectin Man? I would like both." So I thought I'll do this. So this is the superhero Ivermectin Man, and maybe then we can have him in action as well. For example, stabbing a sword in what is that? The SARS-CoV-2, or making a pose with SARS-CoV-2 or something like that. So Denise says, "No, don't change your style." So this is honestly, this is my style. If you go back to any of my lecture, now you're going to start noticing it. My cartoons only have a mouth and eyes, and that's it. They don't have nose. Maybe I do not know how to draw noses. That is why. Franz says, "I love his expression, love your style as is." Okay, so I'm gonna put this on a t-shirt. One, his eyes are kind of crazy as well. He's like, don't know where he's looking. But what we'll do is then we would make some more poses as well. I was trying to hire someone who can do some animatics for Ivermectin Man. So I wanted to make a short movie, 2 or 3 minutes video of how frustrated the Ivermectin Man is. And imagine if the SARS-CoV-2 is sitting next with at a bar with WHO and CDC people and kind of drinking with them and looking at Ivermectin Man who's sitting somewhere sad that he can help. So it takes a lot of time to do those things. So I don't have that time in the midst of all of this lecture. So I was thinking to hire someone to do those animatics. So Liza says IVM instead of just I. So here, instead of just I should say IVM. So then I would make this I a little smaller. What do you think? Others, vote please. So Trillium Lane says, "I want the Ivermectin Man shirt." So today we'll finalize this design. It is actually done in high res, and I would put up the t-shirts by tomorrow. So Jenna says, "Keep I." Lisa says, "Yes, IVM." Maybe I should make both. So if somebody just likes I, they can have that. So I would stand for me as well, I. And then somebody wants IVM, they can have that too. Barbara says, "Maybe he loses his sense of smell, then gets pissed and strikes." Yeah, maybe his flavor is gone as well. So Paul says, "I is fine with me, just like Superman." So let's do this. I'll make two, one with I and one with IVM. So whichever suits you, take that. Dorothy says you should team up with Doug Tenapple. Who is Doug Tenapple? I'll have to now look him up. Oh, he seems like a famous person. Doug. Doug Richard Tenapel is an American animator, writer, cartoonist, video game designer. Oh man, would it be too expensive for someone like me to work with? Would he even work? Wow, his work is awesome. Look at this. I love his work. I wish he can work with us and help us make some tiny shorts for Ivermectin Man. So I have big ideas that I want to execute. So zip fleece like jacket because infusion. I'm so cold, but have to have zip front. Okay, so I think on Teespring, I can create a bunch of apparel types. So what I'll do is I'll start with the t-shirts and jackets, and then you can tell me what kind, and I would just keep adding them. Trillium says I like IBM, so I'll make both. Oh, I like this idea. Start a new WHO and FDA. Yes, we should. Oh, I like this. Gold Country says he needs a D3 band around his arm or maybe holding a shield with D3 on it. I like that idea. That ivermectin plus vitamin D. Let me get this one out. Otherwise, he's going to just stay stuck in the Dr. Bean caves forever. So let me get him out, and then we would add more to it. I like this. C-Max says we need to spam him with ivermectin man comments. That would be so nice. Maybe we should just start spamming him with this picture, and he would get fed up and say, "What is this?" And then we'll convince him. Texas Max says, "Or go the fundraising T-shirt provider. Don't forget zinc." So that is like the complete prophylaxis and management. So maybe ivermectin has various weapons that have various things on them. Jenna says, need to print, I believe in the Ivermectin Man, COVID-19 cure. Maybe on the back of the t-shirt, it should say, I believe in the Ivermectin Man, COVID-19 cure. And in the front is this I. Yes, Pauline says, need a female superpower too. So I was thinking of making an Ivermectin woman as well. Mask plus two shields. Yes. Luckily, because he doesn't have a nose, the that part of the mask is not needed. So should we put a mask on him? Oh my does. I see they're banning ivermectin. Have you looked into wormwood? I hope they're not gonna ban it. Please. Wormwood, I have read a little bit. That is correct. Simple Meerkat says cure strong messaging. That is correct. Skyfrog says no mask. So I think let's get him out like this, and then we would create more. Samina says ivermectin woman. And Samina, thank you so much for the donation as well. Your family members here, they had reached out and they have sent a donation. So thank you very much. Spear. So we'll make the ivermectin man in various superhero poses. I always laugh when I look at him. He seems so cute to me. Building Maker says, can you put a pop balloon with WHO in it? Yes. WHO has just let us down at so many levels. From their, remember they had a tweet. I actually tweeted back to WHO yesterday after their this ivermectin thing, and remember they had tweeted that we have found no evidence of coronavirus's person to person transmission. So I tweeted back to them and I said, this you? I mean, they have kept up with their incompetence. What is good about WHO is they have not changed. This is how they were. This is how incompetent they were. And they are showing that, hey, we are still the same. Yes, you're right. Yes, yes, that was a burn. And then I also tweeted one more time to them, and I said, "The good news is that you have kept up with your incompetence." I'm paraphrasing. With your, you have stayed consistent with your bad assessments of things. And I forwarded them their own previous silly assessments. Yep, they're the one who said it was fine. That is correct. They have made themselves irrelevant. Actually, they have made themselves harmful. Irrelevant is that, hey, you know what, just don't care about them. They have made themselves harmful because there are authorities who are going to listen to them. And it is not that they are zero, they are now negative, they are going to cause damage. That's correct, Afia. Yes. Bob says, Dr. Mubin, do you know if the areas in India, Maharashtra in particular, that have increased death rates are using ivermectin? Areas that appear to be using ivermectin have low death rates. Um, that is what a cool bean from India had sent me. They sent me a link, which I unfortunately have not presented it. They sent me a link to say that here is state by state cases, and those states that are using ivermectin have lower number of cases. I need to go and check that out by myself instead of just saying it to you. So I would do that research. You're correct. Yeah, he was being kind to them. So Kevin says, Dr. Bean, make a T-shirt when where Ivermectin Man and Luffy stand in front of a chart. I love this idea. So Luffy and Ivermectin Man are going like, this chart all flattened. I like that idea. Fishtail says, can you comment on Brazil? So let's see. Actually, somebody had also commented today, which was very interesting for me to see. And they had said that, how about UAE? They have almost vaccinated a lot of people, and there we should see the results as well. So let's do that. Um, so let's see. Israel, good numbers continuing to go down. Um, Active cases, look at that, continuing to go down, almost down. 7,000 active cases, and the death rates are going down as well. This is good. Although many folks from Israel have become upset that, hey, that green passport, and you cannot go somewhere if you haven't gotten a vaccine. They're upset about it, but still, it's good work that they have gotten the cases under control. UK, look at this. UK has become somehow consistent and very slowly reducing, but still, good job on UK's part. And look at this number of deaths. This is beautiful as well. I love it. So now let's see Brazil. Oh wow, still high up. If you do 7 day average, high up. Third day, 3 day average. So their peak is still continuing. Active cases are high, 1.2 million active cases, and number of deaths are very high as well. Brazil is not doing good. Okay, so let's say UAE, if just typing UAE, United Arab Emirates. Okay, hold on while I. My computer is such a lazy computer that when I try to do this, see what it is doing? So I'm going to do this worldometer, worldometer UAE. United Arab Emirates. I'm going to close this guy. So this is what somebody was commenting, that they have almost vaccinated 75% of their population. So if we look at the vaccination, Bloomberg vaccination, also before we go today, I wanted to do diabetes, continue with the diabetes topics tomorrow and day after. Do you think that makes sense? Or is there any COVID related topic you would like to prioritize? So here, UAE, 8.4 million doses given, 39% of population. So let's see, maybe one dose is more. So it is, so here, UAE, what? It doesn't show one or two. So 39% of population, not 70. So I think at the moment then we should not comment too much, but they are coming down, not drastically. And how about the number of deaths? Number of deaths are coming down more, which is good. Now, what else? India is interesting for me. Let's look at US and then India. India is interesting because they have a huge population. Look at this. So US is now, it seems like going back up. Maybe it would come down. Much better than where we were, but not going down like UK or Israel or Vietnam or South Korea. What India? Oh, wow. They have a second wave going. 81,000. So they have a second wave. Their cases are going up. And of course, deaths are following. How about Pakistan? Pakistan, third wave. And I am hearing a lot. For example, my own tech team, the members are who are youngsters. They are becoming sick. So I have a few folks in India who are part of my tech team. Few are in Pakistan, and some of them are in Pakistan are becoming sick. And it seems like it is zipping around in the society very fast. So they, I think, have variants now. The other interesting thing is that people are on average becoming sick, at least youngsters, and by youngster 40 50, I'm counting them in youngsters because I'm in that range too. But what I'm seeing is that 7-8 days and they become okay. So deaths are going up. So Michelle says, are there set standards and guidelines for medication protocol that WHO? No. WHO is World Health Organization. They are the guidelines and helping hand. They cannot be held accountable for anything until the countries come together and say, guys, you need to do better. CMAC, thank you very much for the super chat. Doug says herd stupidity. Skyfrog says, interesting to compare Florida and New Jersey. Can we do that? Can we go to, when I went to US, I saw the states. So let's see, US. Now, let's say Florida. What is the population of Florida? So total cases, new cases, total deaths. Alexa, what is the population of Florida?
The population of Florida
I
is
just
about
found it.
21,700,000.
I just found it. So 21 million for. So if we go to Florida, for example, 21 million folks. So it seems like they have a tiny third wave, but mostly they are down, which is good. Active cases are downwards as well. And I'm sure number of deaths are spiking. I think this may be just data reporting. If their data reporting is correct, then so USA, Florida, and you were saying Florida versus New Jersey. Let's see. Florida, so 21 million. New Jersey, I just saw here. New Jersey, population, is this the population? 12 million? No, population is this column. So New Jersey population column is 8.8, so almost lesser than half of Florida. And not good. They almost have a third wave, which is kind of becoming equal to their second wave. Active cases are going up, and number of deaths are down, which is good. So, and that may be just because both states have a population, of course, lesser than the US. What is the Skyfrog? What was your thinking when you wanted to compare them to? Poland is doing poorly, John Snyder says. So let's see. Poland. I do not know how to type Poland. And it's not going to come back. Worldometer Poland. It's the worldometer that does this to me. Poland. Here. Oh, wow. Poland is not doing good. What is their population? Poland. Alexa, what is the population for Poland?
In 2020, the population of Poland was 37.8 million people.
37.8. And the cases are going up. Their active cases are going up. So they have a second wave. And their death rate is high. Their deaths are high. I do not know if the rate is fine or not. Looking at that, they cannot be fine, but deaths are going up as well. We should look at some country which has ivermectin freely, actively being used. Country, hospital, clinic, and then see. Christine says, Susan Pig, the horse is called Ivermectin. Very nice. How about IV to link up with doctors' else effort? Yeah. So the Ivermectin Man and the IV that she has in her animatics. Denise is saying we are looking at a highly controlled and vaccinated state to free for all state-only vaccinated seniors. Interesting. Trevor says much of the Canada back into lockdown. Hopefully cases fall. So let's see. How's Canada doing? Total cases are up, but they are cumulative. So they are developing a third wave. So first wave, then second wave was larger. Third wave seems to be becoming bigger. Active cases are going up, 49,568. And deaths are going up, I think not at the same rate, which may be the good thing, which is the good thing. So Jem said, isn't Zimbabwe using ivermectin? Don't know. Paul Borg says, Texas still opening and rates down 30 million. So let's see. I was I was reading a comment. So what were we going to look at? Canada, we just looked at it. I forgot. Steve Westman says, Dr. Bean, do you and your colleagues discuss a lack of national coordination in setting preventive measures? Governors and mayors should be taking virus public health policies independently. Yes. And we in the offline chats, sometimes I feel it is interesting for Cool Beans to hear these offline chats. The problem is that many of these discussions are off the record, and so I don't want to disclose. But there is so much disappointment for we are so, at least in the US, we have become so polarized, and all communities, and we as humans have always been polarized. Even in one family, when you talk about some topic, 4 or 5 people in the family do not agree on the same one thing. So it's difficult to expect everyone to just be on the same page every time. But even in this case, our medical professionals, what really disturbed me this morning was that Dr. Laurie, when she showed me WHO looking at the data, first they cherry picked the wrong or those studies which would not show good data. Then they did meta-analysis of that. Meta-analysis was showing good result, and they narrated it negatively. This is how bad things have become. And then people have gone into corners. There are people who say whatever WHO is saying is correct, and ivermectin is silly and we should not use it. And that actually is a majority of the doctors and folks with that opinion. And then there are folks like us who are saying ivermectin is important and we should use it. And the whole thing just becomes muddy with this. The actual scientific analysis to come back and say, here is the science and it works and we should do it, that should be the leaders, FDAs, CDCs, WHOs. They themselves are incorrect at this time. So this is that leadership vacuum that we are seeing. Bob Vessel says, Dr. Corey is so frustrated. Go see him whenever. He naturally will be. And without naming any names, the common thing that I'm seeing after speaking with these doctors that come and be guests on our channels, many of them are not getting their further jobs or contracts or consultations because of their opinions. And that is a sad thing. Doug says Bulgaria and Slovakia. So let's look at it. Bulgaria. So second wave going up. Active cases going up. Death rates going up. So not good. And how about Slovakia? So worldometer, Slovakia. Active cases kind of going downwards. So if I do a trend on them, they are going downwards, which is a good news. New cases are downwards. Active cases are the third peak and largest peak. And number of deaths are also increasing. So interestingly, the new cases have started going down. If you see here, 7 days or 3 days, but yet the active cases are high. So this looks like a more recent change, that there is something that is controlling it. Samina says, what's the reaction of Dr. Paul Marik now about WHO? So I have to ask him. I was asking him something else this morning, so I thought one question is sufficient and not just keep asking him more questions. So I didn't ask him more, but I would ask him. And I'm going to call Dr. Corey as well. I was texting Dr. Corey for some vaccine related discussions to both Paul Marek and Dr. Corey. Texas Max says, Dr. Bean, sad to hear of awful discrimination. Doctors need being built up. Yes. Yeah. So I can tell you that those folks who have been here and have been vocal about ivermectin, some of them have said that, hey, we are not getting any further consultations. We're not getting any further jobs, you can say. Bobby Bates says, question, Dr. Bean, explain diabetes and leakage in eye have to retina specialist. Okay. I have to, okay. So Diversity Love is saying that, is that the computer? No. so what happened was that my glove has upgraded itself. This was my computer glove, but then I have developed, I think I started doing these 4 talks every day, and so I draw a lot. So I developed a pinched nerve and some tendonitis. So I wear this. It helps with the drawing as well, plus it is supporting my hand as well, because I developed a little bit of pain for a couple of weeks. C-Max says it upgraded itself. No, I had to go to a pharmacy and get this upgrade. Scarlett says, get up and walk around. I do that, but somehow I ended up with the nerve. So I think the shoulder posture is not correct, and then I did some tendonitis as well because of the way. So first, I used to use this keyboard pad, and let me actually stop sharing. So I used to use this one, and for this one, if I had to highlight something, I would have to drag my finger on it, press it and drag it. So that created some pain here. So I changed it with the other mouse, but that was a little heavy. So every time I'll move it around, it caused this stress on the hand. So yes, tennis ball and roll on the wall on your back. Yes, so I'm doing that. I'm doing a bunch of things. Eugenie says, computers are not made for human bodies. Yes. Cool. So Rita says, hi, Oti and Noreen. Dr. Bean is very interesting and knowledgeable. Thank you very much. Actually, I really feel very proud of this, that the Cool Beans here, as much as that we have developed a tribe where we can actually disagree with each other. I think the only time when I become a little upset is when people start insulting. And so nowadays I've just started to block folks who would just start coming in. For example, this morning somebody was really insulting Dr. Laurie. And so I just, in the previous videos, I would leave them there thinking that this is just freedom of expression and this is their opinion. But I think it is not the most healthy way to have a dialogue. So I removed them, I blocked them. So the more recent is that we would just continue to have a better dialogue. So Golmuk says that, Dr. Bean, believe it or not, some mice made for gamers are the most comfortable, though they do cost a bit more. So yes, so one of the Cool Beans actually has gifted me a mouse. So hopefully it would be here today or tomorrow. And that is a gaming mouse with it's a vertical mouse. So it kind of reduces this stress on it. So thank you to that Cool Bean. And once I get it, we'll see what happens. CMAX says needs a week off for occupational therapy. Yes, I actually don't want to take an off because these are important times, and we just sit down together and we talk and we have fun and we discuss things and we stay up to date. And most importantly, I think we stay less scared of the things outside. Yes. Yes, Gulmo. Yes, so Zia, this is what I was very proud of. That the cool beans, this is what I was saying and I forgot. Cool beans, I feel this is a tribe, regardless of our disagreements. For example, a few days ago, some cool beans are very upset that why am I talking more about AstraZeneca? They're still sending me messages and hate and all that. But cool beans are still very, very much informed and very much up with the how to look at a study and look at the numbers and how to understand it crossed the unity or not, and the significance of this. So we are actually very, I don't want to use the word educated because who am I to educate, but we educated ourselves in this whole 1 year enough that we can have very healthy dialogue with those doctors as well. That's what I was very proud of this morning, that it is Dr. Lori's business to look at analysis and do meta analysis and then present it. And it was interesting that we were able to actually understand what she was saying. Jana Taylor says, "What's your favorite electrolytes without sugar?" So I just I don't drink any electrolyte water thing. You're meeting a simple person. Kevin says, Dr. Bean, once starting ivermectin, how long until it is active in system? So it takes a peak in plasma within 4 to 6 hours. Then it has a half-life at 18 hours. But this is also something that I have been promising to look up, and that is it stays in the body somewhere. It is distributed and it stays because for a month it keeps helping after 2 doses. So that means it has to be sitting somewhere and slowly getting metabolized and be used up. Where exactly in the tissues does it get distributed and stay is not clear to me because I didn't read it yet. So I have to read that. But normal pharmacodynamics and kinetics are that it takes a peak in 4 to 6 hours and then half life of 18 hours. Mohammed Minhaj says Dr. Bean is very handsome. Assalamu alaikum. Wa alaikum assalam. Um, Julia says, new to tribe critical care nurse, are you seeing increase of TIN strokes post COVID? Probably need to run D-dimers clinic site to help. So I have not in my patients, and I don't practice in the US. However, this is something I was discussing with some of the doctors because once I talked more about AstraZeneca, and some of the cool beans became very upset that why am I talking AstraZeneca and it is a very small number of people getting clots, and then even to the point that somebody tweeted at me, who's a doctor, that hey, these clots are equal to the number of clots in the same population otherwise as well, so this is actually not even information. um, and when I was so I was definitely curious then that are we led to the wrong path? Is the media doing a naughty thing with AstraZeneca? So I was asking other doctors, and many of the doctors in the ICUs as well, many of the doctors who are seeing patients, and they're I said that, hey, just give me advice for me. And they said adenovirus based vaccines are showing this. And this is what then reminded me. I discussed it yesterday with team as well when I said comparing three vaccines, which also made some more cool beans mad as well, that why I keep comparing them. But we had been talking about comparing them. Uh, where Johnson and Johnson had said this blurb that we are aware of the issues with clotting and with other issues. So it seems like some adenovirus based vaccines may have this known outcome. So to answer your question, Julia, yes, there is that. I am not directly seeing it because I'm not working in ICUs, but there are folks who are working in ICUs, and I asked them for myself, and they said yes. So there are folks like this as well. So Fox Burrows saying, go back and read the Gita, liar. So I don't know if you're talking to me, and then if you're looking at me and thinking that I may be a Hindu, I'm not a Hindu. So I'm not going to go back and read Gita. And or I don't know who you're saying it to, but these are the kind of folks who get blocked at my channel. Doug says, can we look at Texas? So let's do that. So let's look at Texas. So if I go to US, and then here, so Texas population is 28.9, so almost 29 million. And let's see. So daily new cases. So if you see here, they are actually dropping. So this is Texas. Daily new cases are dropping. Hey, Luffy. What happened? What? Did Kyrie beat you up? I'm sure Kyrie did this to you, right? So Luffy's here. Active cases 99,000. So active cases are dropping. And the death rate is dropping as well. So generally, it looks like Texas is on the right track. So Kevin says, would you get the Pfizer vaccine yourself? Do you feel it's safer, or will you wait for Novavax or until we have more data? So I was actually trying to get myself scheduled for a vaccine this morning because I have become eligible, although they came back and they said we don't have appointments available yet. And this is why I was asking various doctors as well. So my hope is either Moderna or Pfizer, messenger RNA based, and then adenovirus based. So that reduces the chance of clotting. But these vaccines have a chance of tinnitus and those. So I am kind of torn. But at the same time, if you ask me that, hey, you have to choose one, I'll choose Moderna, then I'll choose Pfizer. Then if I have to, then I'll take Johnson & Johnson. If I have to, and let's say that's the only option, I'll take AstraZeneca. If I have to, then if there is something available like Novavax, I'll take that first. Cool. Barbara is saying, Luffy and I'll read the Gita together along with many other books. He's expressing a serious. Our guru Luffy, his Swami for being meditation. Hey Luffy, what happened? He knows that we're talking about him. Luffy, what happened? Come here. Come here. So see, he wants me to open the door for him to go. I'm going to quickly catch him and bring him here. Okay. You want to go here, Luffy? So here is Luffy. Luffy, what's happening? Okay, so I'm going to open the door for him. He knows this. So if he has to go to the other room, he just comes in here and starts meowing. Cool. So Nina Cooper says, cute. Yes, he is. Rima is here. He's such a beautiful color. He does. He's a Bengal. So Rima, once again, my apologies. I still have not checked. I probably need a reminder. I'm going to try to do it soon after this. Okay, so let's answer a couple of more questions and then we break for today. Thank you, Samina. Craig Fryer says, howdy from Austin, Texas. The CDC reports a 99.5% reduction in type A and B influenza. Really, third waves. Please comment. Thanks. So interesting. If you watch my previous year's videos, somewhere in August, September timeframe, folks had asked me that, hey, what do you think? Would we have a more um, bad, worst flu? Because that is what the news was, that, hey, the flu season is going to be really bad. And I was saying that no, we would not see a larger flu season. I thought that we would not see much. And the reason, and it is in those videos, the reason I thought was that we are social distancing, we are wearing masks, we are keeping care with the hygiene, we are protecting our old, we are trying our best in our various ways to protect ourselves and keep clean and protect our elderly. So why would we then have a respiratory disease to become spread if we are doing all of these careful processes? So I think that is the reason that flu is not that much. Cool. John Snyder, thank you very much. This is a mouse for Luffy. Luffy has his little. So here is his little fish that he plays with. So he plays with this. So this is his catnip, and he plays with this, and then just sits with it all the time, thinking it is his little hunt. Building maker says, so okay, we stop after this. Building maker says, good grief, we are washing our hands off. How could we spread the flu? Yes. So that is the thing. And I had already been saying this, that hey, we would have less respiratory and less hygiene related communicable diseases. And that's what we saw. So this is a good question. Marco Kane says, I had the AZ wax yesterday, so congratulations, but I have a metallic taste after it. What mechanism might cause that? It started after 5 minutes or so. Many times what happens is that some of the vaccinations or drugs or foods can cause inflammatory cytokines, which can then be secreted in our saliva. So that such folks are called secretors. And we all secrete it, it's just that they secrete in different proportions, and that taste can then be felt. So Liza says, do you think that ivermectin injections will take tablets out of the market? I think not. Here is why. One of the studies with ivermectin was with injectable ivermectin, and it did not do very well. And I was talking with one of these doctors folks who we've been talking with, and they said that it seems like injectable ivermectin is not doing as good as oral. It is still difficult for me to comprehend that, because we take it orally or we take it through injection. Eventually, if it needs to be further modified in the liver, it's going to reach liver and get modified. So I have to do some more research on that. So that is a theory that I heard from a doctor, because there is a study that showed injectable may not be as potent. I haven't looked at the study myself, so I have to look at it to see exactly what happened. Julia says, I love Luffy, his muses. Absolutely. And some people send me, the folks who are new, they think that I keep Luffy hungry, or he's stuck somewhere here, and so we are kind of hard on him. It is not that. It is Luffy, this is just how he is. He is loud. Cool. So how about we stop today, and we will continue our discussion tomorrow. Please do me a favor. Can you please comment, go to diabetes tomorrow or some other topic? I would like to continue discussing diabetes as well, so we don't forget what we were talking about. So with this, thank you very much. Please like, subscribe, and share. If you are not going to subscribe or share, just hit like on it. That is helpful as well. And then there are 3 links in this description. One link is if you would like to become a patron for this work for healthcare workers and medical students. Another link is if you would like to buy me a coffee, and then there's a third link to support this work in general. So thank you very much, and I would see you tomorrow. Bye bye for now.